Hey everyone, my name is Amy McCarthy and I'm from the MFM Clinic. We're going to be talking a little bit today about gestational diabetes, answer any questions you may have, and just go over your general diagnosis. You're probably watching this video because you were told that you have gestational diabetes. The purpose of this video is to clarify any concerns that you may have with this new diagnosis. Gestational diabetes is the type of diabetes that occurs in pregnancy. You may be asking yourself, why me? During pregnancy, an organ called the placenta develops in the mother's womb. This organ connects mother and baby and is responsible for baby's adequate food supply. The placenta frees a substance that blocks insulin function, resulting in insulin resistance. To overcome this resistance, pregnant women need up to 3 times more insulin than normal. Gestational diabetes starts when an organ called the pancreas cannot produce enough insulin needed during pregnancy. Without enough insulin, sugar that is in the blood cannot be converted into energy. The sugar level accumulates in the blood and produces hyperglycemia, meaning high sugar. Gestational diabetes affects 5 to 10% of all pregnancies, but is more frequent in women with the following risk factors: ages 25 years or older, overweight, ethnicities including African American, Hispanic, and Asian, family history of diabetes, history of gestational diabetes in prior pregnancies, as well as a history of a larger baby. There are other types of diabetes. Type 1 diabetes, this occurs when your immune system, the body system for fighting infections, attacks and destroys the insulin-producing beta cells of the pancreas. Scientists think that type 1 diabetes is caused by genes and environmental factors. Type 2 diabetes occurs when your body doesn't make enough insulin or doesn't use insulin efficiently. With insulin, your body cells can't use glucose for the energy it needs. This leads to excess glucose in your blood. Gestational diabetes in general does not cause any symptoms or discomfort to mothers. For this reason, during prenatal care, mothers have a glucose tolerance test at 24 to 28 weeks. If this test is positive, the provider will order a longer glucose tolerance test, usually taking about 3 hours. If you have a history of gestational diabetes, this test will be ordered at your first prenatal visit. How can gestational diabetes affect my pregnancy? Usually, gestational diabetes is a very mild disorder for mother, but can cause some other complications throughout pregnancy. For moms, these complications may include premature contractions, impact on your blood pressure, abnormal amniotic fluid, urinary and vaginal infections, as well as increased bleeding at delivery. For babies, complications may include being larger, 9 pounds or greater, obesity later in life, fetal distress at delivery, trauma at birth, and brain development delays. These complications can be prevented by maintaining adequate levels of sugar in your blood. There are 3 ways to control high sugar levels: diet, exercise, as well as medications. Diet is the best way to treat gestational diabetes. If the meal plan is followed, 85% of patients will achieve adequate control. The meal plan consists of 2,000 calories divided into 3 meals, breakfast, lunch, and dinner, with 3 snacks in between. It's important to limit simple carbohydrates such as sugar, honey, sodas, cookies, and cake. The American Diabetes Association recommends 30 minutes of walking at least 5 times a week. Diet and exercise may control high sugar levels in 85% of patients. The other 15% may need medication. Insulin is prescribed when diet and exercise don't adequately control high sugar levels. Insulin administration is an injection form, as oral pills are contraindicated in pregnancy. Insulin administered to mothers do not harm the fetus. Usually after delivery, sugar levels return to normal and the insulin is stopped. Now let's talk about how you would know if your treatment is working. Sugar levels can be checked with 1 drop of blood from your finger. This will tell your provider if your prescribed treatment is working. We recommend you check sugars 4 times a day, fasting, and 2 hours after each meal. You will log your results in a booklet that will be provided with your diabetic kit. Glycemic control is as follows. Fasting results, we want those to be between 60 to 90, and then 2 hours after each meal, 90 to 120. If you can achieve adequate control, delivery and breastfeeding will be the same as any patient without diabetes. You may be wondering what happens to gestational diabetes after delivery. For the majority of women, gestational diabetes disappears after delivery, approximately about 95%. In a small percentage of cases, diabetes will continue. That is why there is a recommendation for evaluation with another glucose tolerance test 2 months after delivery or after you finish breastfeeding to make sure diabetes has resolved. Breastfeeding is highly recommended to help maintain your blood sugars as well as babies. Even if diabetes has resolved, we recommend evaluation every 2 to 3 years. Women who have had gestational diabetes have a higher chance of developing type 2 diabetes. Risk of developing diabetes correlates with family history, obesity, and a sedentary lifestyle. We encourage women to lose all the weight gained in pregnancy, maintain a healthy diet, and to be active. Breastfeeding burns extra calories, so it can help you to lose that pregnancy weight faster. Overall, the majority of women with gestational diabetes will have a normal pregnancy and deliver a healthy baby. If you maintain an adequate sugar level, the risk of developing complications are the same as for non-diabetic women. But with no treatment, gestational diabetes can cause complications to both mom and baby. It is very important that you collaborate with your healthcare professionals to control your blood sugar levels. Thank you so much for joining us for this presentation about gestational diabetes. If you have any further questions, we recommend that you talk with your doctors when you come in for your appointment in the MFM clinic.